insulin. Insulin syringe is this everywhere that you go to, nursing home hospitals. This is only used for insulin, guys. Alright, you see it? It's only for insulin. Everybody see it?
Yes.
Only insulin. It's in units. Also have ml next to it, but mostly we use the unit. Grab my insulin. Okay. I'm going to pretend this is my insulin. Whoever that is, don't turn it off, please. Guys, don't ever let me see you give injection without gloves. What if he rules out? Alright, you always wear your gloves. So I have my supplies, my syringe, my insulin, alcohol swabs, my gloves. Those are the supplies that I need. Now, let's assume my insulin is right here in my medication cart. That's where it will be in the med room. My three what? What's the three things I want to check? Identifier, okay? Verification.
Expiration.
Where's my insulin? I don't want to go for. Alright? Humulin N.
Expiration.
Humulin N. Right? First one. I've checked. Grab it. Good morning, Miss Smith. How are you doing today? My name is Toyin. I have your insulin for you this morning. I did your blood sugar already and it's 300 and something. So 350, don't let me say something. It's 352. So we're going to give you your Humulin hand now. But give me a second to go and wash my hand. Put my stuff down. Wash my hands. Alright. Come back. Alright, Miss Smith. Knock, knock. I'm back. May I please check your bracelet? Can you please tell me your name? Smith. My medication record? Smith. Smith. She says Smith. Right? Identify my patient. At the same time, when I do those three things, it's what? Right patient. Alright? Check my patient. Have my supplies. Put on my gloves. I'm not going to go through this process when I demonstrate I am. It's the same thing, right? So we got it once, we're going to get it. I'm just going to go straight into actually giving it. Okay, I have my supplies, I have my insulin. Okay. Before I give it, Humulin N, 10 units. My second one. Check. 10 units. All right, let's see. Wipe. Guys, wiping is not like this. It's not like this. That's not cleaning. Cleaning, okay, you cleaning. Okay, so I clean. Did I not bring my syringe? Insulin syringe, only for insulin. Don't go grab your regular syringe for insulin. Alright? How many units am I given? 10. I'll pass this around so you guys see. 10. I'm going to drop 10 cc, 10 units of here. Whenever you draw from this, you need to instill this same amount of volume that you're going to administer of here into that. 10 units. You notice where I'm holding? Automatically. Alright, I'm not touching the plunger. 10 units. Go in. Push in. Drop my 10. I could draw up to 35 units at this point, right? I could fill up the syringe. Alright, I have my 10, I have that. Tap. Get the bubbles out. Now I can push it back in till I get my 10. Some hospitals follow hospitals and procedure. They need 2 nurses to check insulin. follow your policy and procedure. 2 nurses to check insulin. Do anybody notice how I'm holding my syringe?
Away.
And I don't even smoke. I've never smoked a day in my life, even as a teenager. Don't drink, don't smoke. Automatically, it keeps my finger away from where I don't need it to touch. I don't drink, but I know how to hold a cigarette because I've held enough syringes, all right? Because I cannot recap. So I just hold my thing. Everything I need is right in there. Another nurse checking. I'm ready to give it. We'll check again. Humulin and 10 units, 10 units. Where's my alcohol swab? Notice I brought 2 alcohol swabs. Find my site. All right, Ms. Smith, I'm going to give you your injection now. Okay? Circular motion from the insertion side outward, just like when you're cleaning a wound. You're cleaning from inside out, right? Put my alcohol swab right there. Now, when we give sub-Q, all right. Oh, I usually just put it back in there and put it up here.
When you
use sub-Q.
All right, when you wipe with alcohol, let it dry, please. Because if you punch a hole in that wet alcohol, you instill in that alcohol in them. So let it dry. All right? When you give sub-Q, this is another critical element. When you give sub-Q, you have to what with the skin? Pinch or spray? Pinch. You got to pinch the skin. Can you get up? Let me show you. I ain't going to kill her. Turn around. She's not getting the fluid. Pinch the skin. We see it? Pinch like that. When you're giving sub-Q, why? Because it says subcutaneous. We want it under the skin. By me pinching, the muscle is way down there somewhere, right? Pinch the skin for sub-Q. Any sub-Q you're giving, you pinch. If I'm going to give IM to get it into the muscle, stretch it. You see that? And while I put that needle in, it's going to remain stretched. When I push the fluid medication in, it's going to remain stretched. When I'm done, then that's it. All right, we got that? That's a critical element, guys.
Pinch skin, sub-Q, scratch skin, IM.
Yes, ma'am.
Thank you.
All right, I've wiped. Okay. Now, with insulin, now it's good. It used to be 45-degree angle. Now you don't even need to try to remember which one is 45, which one is 90. It's recommended now that we can give any sub-Q at a 90-degree angle. I am definitely at a 90-degree angle. Is this 90 degree?
No.
If I give it like that, it's 45 degree, which is okay for sub-Q. Right. Meaning on the test, I need to remember which, many minimums. Which one is up, which one is up 45, which one is 90, I'm thinking. But if you think of all of them as 90, then there's no reason for that, right? Yeah. Practice utilizing 90. I'll give you a little clue to help you remember. Make life easy. 90 degree. Pinch, right? Go in. Push your medicine in. For sub-Q, we do not aspirate back. When I mean by aspirate, I will not draw back to see whether or not I'm in the bloodstream. This is in the skin. Push it in. Remove, take my alcohol swab, and just pat it dry. You see how I'm just patting? I'm not putting pressure, just pat it dry. That's all you need to do for sub-Q. Any kind of sub-Q, that's the route. That's the way you administer it. Again, there's so many body part area in your body that you can administer it. Your picture perfect in the book will tell you all the appropriate site in your body for sub-Q and the appropriate site for IM. All right, I'm done. I'm going to recap.
No.
I'll kill you. Take this like this. Your needle box should be right here. And just don't walk around like this. Like that. And just drop it right there in the needle box. Please do not put your finger in the needle box. Just drop it and it should go down. I think I am looking for a portable one. Just drop it like that in the needle box. Okay? In the needle box. Do not leave it on the bed linen for even a second. As soon as you're done, your needle box is right there. If it's by the door, lower the patient's bed and go drop it. Don't ever lay it on the bed because you can forget. And if you forget, whoever is coming in to change that linen will get stuck. That's how we get our housekeepers or PCA into trouble. So please drop it, never recap. I'm done with that. All right, Miss Smith, I'm done. Lower the bed, put the call bell within reach. Is there anything else, Miss Smith, that I can do for you before I go to my next patient room? This is your call bell. I'm going to take off my gloves, wash my hands, and I'm going to sign that I gave that medication. Signing meaning documenting. Medication will sign. Don't videotape it.